Hi ladies, welcome back to Hey Dog with me, Dr. Kady. On this channel, we talk about fertility medicine and women's health. This though is another one of our fertility videos. I'm starting a series where I'm going to be talking about the common mistakes that women make when trying to fall pregnant. And some of these key things, would you believe it or not, is the reason why some women spend years trying to fall pregnant without success. Hoping that by the end of these series, you would have addressed all of these factors, ensuring that none of these are the reasons why you are experiencing a delay in falling pregnant. So away with the fluff and straight into the important matters. There are 5 common mistakes that women make when they're trying to fall pregnant naturally and it's just not happening. The 5 main areas that tend to be overlooked include anatomical disorders, pathological disorders, lifestyle factors, genetic disorders, and male infertility factors. The first common mistake that women make when they are trying to fall pregnant and it's just not happened after many years is overlooking anatomical disorders. An anatomical disorder basically means that there is something structurally wrong with the female reproductive system, your womb or your ovary or even your vagina. So if there is something structurally wrong with any part of your reproductive system, the only way that you're going to find out about it is by having a full assessment of your reproductive organs. A full assessment will include having a combination of imaging modalities like having ultrasounds and sometimes even laparoscopies, as well as having a thorough physical examination of your reproductive organ. And that is when the use of devices like the uterine sound will come in. Now, ladies, this is basic. It really is. I would argue that if you've been trying to fall pregnant for any length of time, at least 6 months, and it just has not happened naturally, this type of assessment is a no-brainer. It should be one of the very first things that your doctor does. Now, doing a laparoscopy and a hysteroscopy, those are a little bit more invasive and are more expensive. And I would argue these are investigations that you can leave later on in your journey of trying to fall pregnant if it still doesn't happen after doing all other investigations and ruling out other abnormalities. But an ultrasound though, it's very affordable. An ultrasound will tell you if you have a congenital malformation of your uterus. So these congenital malformations include a bicornuate uterus, having a unicornuate uterus, or a septated uterus. Also, you could have an arcuate uterus, amongst other congenital uterine malformations. Yeah, implantation might happen just fine, but when it comes to the embryo actually growing inside of your womb, you will agree with me that if you have this type of uterine malformation, there's not going to be enough room for the developing embryo to grow in. So you're going to be naturally more susceptible to having miscarriages. However, if the embryo manages to grow even still, despite your uterine malformation, you are going to be more susceptible to preterm birth. And we obviously know that babies who are born preterm are at increased risk of complications and at times, sadly, infant mortality. In addition to the ultrasound giving us information about the uterine cavity itself and telling us whether or not you were born with one of these uterine malformation, it also gives us information about the ovaries. We tend to take things for granted and assume every woman has the 2 ovaries. An ultrasound should be able to tell us whether both of your ovaries are present or whether you just have 1 ovaries or no ovaries at all. So you can imagine if you're a woman who's been trying to get pregnant, many years down the line, you then have an ultrasound that then finds out that you don't have any ovaries. You can imagine how distraught you will feel over all the time that you have lost because pregnancy for you was just not going to happen naturally because you just don't have in the ovaries. But if you are told that you have both ovaries, one of the things that your doctor should be asking for the radiologist to report is your antefollicle count. That tells us how many follicles, so how many developing eggs that you have in each ovary. So if you then have the ultrasound and it's found that you have 2 follicles in the one ovary and just 1 follicle in the other ovary, your doctor should then have that discussion that it is very likely that your ovarian reserve is low. Obviously, that will have to be accompanied with a blood test known as an AMH, but if you get an antefollicle count after having an ultrasound, you know where you stand in trying to fall pregnant naturally. Your ability to fall pregnant naturally is going to be reduced if you do not have a large ovarian reserve. The second aspect of having a full assessment includes the gynecological examination. That will include a bimanual examination, as well as the doctor using a speculum to have a look at the position of your womb. The information that your doctor will be gaining from doing a bimanual exam is your womb bulky? And so you see, by doing something as simple as an examination, your doctor should already be able to tell if your uterus is bulky and therefore you have uterine fibroids that may make it a little bit more challenging for you to fall pregnant. So if you've got a subserosal type of fibroid, which your doctor should be able to tell by just examining you, what will happen is that you may get pregnant and you may have fertilization that happens in your fallopian tube, but the fertilized egg is not able to implant itself. Another piece of information that will come out of doing a full examination is the position of your uterus. If it is found that your uterus is retroflexed or retroverted, very often it causes no problem. And many other women who have these uterine positions who are able to fall pregnant naturally with no trouble. But if you have been struggling to get pregnant and there have been some delays, and then you're found to have a retroverted or retroflexed uterus, what that may mean is that it may have significant implication on the position and the direction in which your cervix is facing. So if you've got a retroflex uterus, your cervix may be pressing against your vaginal wall, and sometimes that may cause some challenges for the sperm cells to swim through the entrance of your cervix. The percentage of women for whom that is a significant problem is small, but if you are struggling to fall pregnant, that's obviously something that you cannot afford to overlook. And you would be overlooking something so simple by not having an examination done. Finally, when we talk about anatomical disorders being one of the things that women overlook when they are trying to fall pregnant, having cervical stenosis and not knowing that you have cervical stenosis is one of the biggest common mistakes that women can make when they are trying to fall pregnant, and literally not knowing. There is no way that a sperm cell is ever going to be able to swim through their cervical os. Why? The cervical os is the entrance through the cervix that allows the sperm cells to have access into the uterine cavity and eventually goes to the fallopian tube where it will meet the egg. If your cervical os is completely closed, which is what happens in cervical stenosis, you're going to spend money and time doing lots of different investigations, all of which may come back as normal when, because you've not had an examination, your doctor has not used any uterine sound to be able to put through your cervical os. You will never know that your cervix is actually closed. So you see, doing an examination is absolutely crucial, because it's only when you do an examination that the doctor will then use a uterine sound to be able to put through your cervical os. And if obviously it doesn't go through and it's tight and it's difficult, then other methods of trying to get you pregnant should be adopted sooner rather than later. So that's it for this episode of common mistakes that women make when trying to fall pregnant. For this episode, we looked at the anatomical disorders that women do not know that they have simply because they've not had simple imaging modalities like ultrasound and having a full gynecological examination done. We'll see you in the next episode of common mistakes that women make when trying to fall pregnant. Hope you've enjoyed it, and we'll see you later.